Om Swastiastu. Today we are going to present travel medicine in COVID-19 pandemic era. These are the members of SGD B3. The table of content that we have. First, introduction. There's background information, problem formulation, objectives, and benefits. Second, literature review. There's definition of travel medicine, how travel medicine is impacted by the COVID-19 pandemic, and last, ways of improving the effectiveness of travel medicine during COVID-19. Last is conclusion. There's conclusion and advice.
Thank you for the given time. Allow me to introduce myself. My name is Siwa Guptha, and the three last digits of my name is 072. So right now I'm going to explain you about the background information on which the student project of travel medicine in COVID-19 era is come to an end. So right now I'm going to tell you about how closely related the COVID-19 with the globalization era, which is the rapid transformation of transportation technology, which has led to the gradual development of international traveling activity into its peak. This kind of activity can make a bigger exposure of individuals to a new cultural, psychological, microbiological experience to the human body. This kind of things can lead to the destructive way of the human civilization, especially on the health risk transmissions. The health or traveling related disease transmitted easily in this kind of era, which can make the chance of the global health crisis become possible. For the example is 2019 novel coronavirus came from the Wuhan, China. And then right now, infecting whole world in now era. In order to prevent this disease transmission directly from the travelers, all of the government, especially on the countries which have the tourism sector as their main resources, have to impose the effective program yet so intriguing. The name is travel medicine. Travel medicine, to simply put, it is promoting the healthcare for the travelers, environmental, and regions on which have the highly transmission international activity. In this literature or presentation, we will mostly show the data, development, and the mechanism of the travel medicine in Indonesia. And also this literature and presentation will cover the determination of how effective travel medicine is in order to prevent the adverse health transmitted COVID-19 disease. Thank you for the time. Next.
Okay, my name is Naras with three last digit of name is 074. Okay, we have three problem formulation here. First, what is the meaning of travel medicine? Second, what is the impact does COVID-19 give to travel medicine? And third, how can we improve the effectiveness of travel medicine during COVID-19? The objective also three. First, understanding the meaning of travel medicine. Second, understanding the impact of COVID-19 pandemic era. And third, understanding ways to improving the effectiveness of travel medicine during COVID-19. And for the benefits, there's 4 benefits. First, to show the explanation and comparison about the travel medicine in Indonesia and foreign countries in midst of the COVID-19 outbreak. Second, to influence the importance of travel medicine by giving an explanation about how advantageous it is in order to ensure environmental safety. Third, to indicate the development of travel medicine in Indonesia, thus giving an evaluation to providing a better service of travel medicine in Indonesia. Last, to give a better insight into travel medicine application in Indonesia, especially to the medical student at Udayana University. Next.
Hello, good afternoon. My name is Aisyah with 3 last digit names 076. So I'm going to discuss about literature review, and these are the subtopic: definition of travel medicine, how travel medicine is impacted by the COVID-19 pandemic, and ways of improving the effectiveness of travel medicine during COVID-19. The first one is definition of travel medicine. So travel medicine is defined as the practice of medicine which focuses primarily on pre-travel preventive care during and post-travel care. So travel medicine plays an important role to make sure the travelers are safe from exposed from any disease. So these are the topics that we will discuss in travel medicine: preventive care and health risk management. And these are the bodies of knowledge in travel medicine. Okay, the first one is epidemiology. Epidemiology is a study of science that learns about disease and health which happen and cover almost the entire world. There are two methods that we use to describe epidemiology as medical clinic. The first one is technical method and the second one is strategic method. And secondly is immunology. Immunology is defined as a study to discover how the body understands the immune system as a whole. And last, vaccinology. Vaccinology is vaccine can save numerous lives in the world by inject weakened virus called antigens to human's immune system in order to respond, remember, and encounters with pathogen antigens. Next is pre-travel. Pre-travel is consultation before traveling that aims to assess risks, provide solutions to minimize the occurrence of a disease. The most important things must cover the traveler's health background, such as immunization, their protection against arthropod bites, injury, and respiratory illness. And also make sure travelers know about any risks and diseases which can expose them while traveling.
Okay, so moving on. Firstly, my name is Carissa Sutedja. With my three last digit name is 080. I'm going to talk about preventive counseling and education. Education of health concerns before, during, and after travel through counseling, which is one of the efforts to minimize the risk of people having health-related issues during those times. For example, avoid consuming tap water, going outdoors during the time when vector animals feed, and walking without protective equipment. Next, we have travel medicine triage algorithm, which is used to decide in urgent situations, which are intended to rapidly identify patients that require immediate handling and attention. Triage system works by screening and determining the level of care by caller designation, by observing the physicians in triage, or PIT, or less commonly an advanced practice provider. And finally, we have come to post-travel. Many post-travel infections are immediately obvious and may appear months or even years after the initial infection. The most frequent causes are the official endemicity of the countries visited, duration of travel, type of vacation, general health of travelers.
Hello, my name is Erika Luis with my last three-digit name 089. In this table, there are three diseases that may be contracted during travel, which is diarrhea, dengue, and malaria, together with the recommended treatment. Now I will explain about the other clinical conditions. There are four main categories of clinical condition. The first one is during or right after travel, for example, baru trauma, jet lag, and motion sickness. And the second one is illnesses affected by environmental challenges, for example, hypothermia and sunburn. And the third one is dangers to personal safety, for example, violent behaviors. And the last one is psychosocial and psychological and psychosocial issues. And for the psychological and psychosocial issues, who would have thought that, on the other hand, traveling can also cause stress. Traveling and air travel may cause depression, anxiety, and even madness in vulnerable people. Some people who have phobias such as claustrophobia, aerophobia may experience these problems even before boarding. And for the administrative and general issues, there are management of travel clinic, travel medicine information, and etc. And for the administrative issues, travelers' procedures for blood transfusion, recommending healthcare facilities in areas with limited resource.
Hi, my name is Aurelia with the last three digit of name is 081. So how travel medicine is impacted by the COVID-19 pandemic. The first subtopic is epidemiology, immunology, or vaccinology. In order to have optimal pre-travel preventive care, it is important to know the epidemiology of travel-related health risks. But the knowledge of specific disease risk in a specific location is puzzling, and the application of evidence-based standards to travel medicine is still a challenge. GeoSentinel, a worldwide surveillance network for travel-related morbidity and mortality, which was established in 1995, provides various epidemiologic features needed in pre-travel risk assessment. The second subtopic is pre-travel assessment or consultation. The most essential element of pre-travel as healthcare is risk assessment. Risk assessment for upcoming travelers is generally considered in the following sequential manner. The first one is to create estimation risk for an average traveler. The second one is for search for specific risk factors needed for individual travelers that may modify the average risk. The third one is to consider the role of prevention methods. And the last one is to estimate for individual risk perception and risk tolerance issues and the likelihood they will accept or decline the interventions offered.
My name is Dharma Yuda with 3-digit number 083. Here I will explain about treatment strategies for high-risk travel. COVID-19, treatment for COVID-19. Based on the severity of the case, COVID-19 treatment is divided into 5 parts. That is without symptom, mild symptom, moderate symptom, severe symptom, and critical symptom. Without symptom, this condition is the mildest condition. After being checked and was proved positive for COVID-19, but no symptom of COVID-19 were found. Mild symptom. Symptoms that appear such as sore throat, nasal congestion, headache, diarrhea, nausea, vomiting, smell, or loss of taste that occur before the onset of respiratory symptoms. Moderate symptom. Moderate symptom has clinical sign of pneumonia, but no sign of severe pneumonia, including SpO2 greater than 93%. Severe symptom. Severe symptom indicate in patient with clinical sign of pneumonia with any of the following symptoms, such as a respiratory rate of greater than 30 times per minute, severe respiratory distress, or SpO2 lower than 92% in room air. 5 is critical symptom. Critical symptoms are experienced by patients with acute distress syndrome, sepsis, and sepsis. For more information on the treatment of COVID-19, you can access the Mata Terlaksana COVID-19 edisi 3. Psychological and psychosocial issue. COVID-19 has a very significant effect on change in tourist behavior. Tourism consumer purchasing will be based on following: A. Tourists demand a higher standard of health insurance. B. Tourist destination with green zone status with a low number of cases will be preferred by tourist visits. C. Giving a discount price by considering by consumer to experience tourism activity based on the motivation to achieve purchasing efficiency. D. Flexibility of booking.
My name is Dia with last 3 digit of NIM 084. So the next one is post-travel assessment. There are several stages of post-travel assessment during COVID-19, including early stage screening, isolate, and final stage screening. The standard method of screening that used in Indonesia based on decree of the Minister of Health is antigen rapid diagnostic test, or AGRDT. AGRDT can detect the active SARS-CoV-2 infections. After getting the result of AGRDT, if the result is negative, the traveler should isolate themselves by 7 days and doing self-quarantine. And then if the test is positive, if the result is positive, the traveler should isolate themselves by 14 days and doing self-monitoring for COVID-19 symptoms. After the isolation is over, the travelers will get another AGRDT test to make sure that they already have negative result for infection by COVID-19. So the next one is administrative and general issues. To prevent the spread of COVID-19, Indonesia's Directorate General of Immigration used health protocols such as, so the first one is health protocols for entering and exiting Indonesian territory. First is always use face mask. Second, everyone is required to have health card and vaccine certificate. And the third one is implementation of keeping distance by 1.5 meters. And the last one is always washing hands with soap or hand sanitizer. So the next one is requirement for entry into Indonesia. The requirements is written on a slide. So the last one is requirement for abandoning Indonesia. And the requirements is also written on the slides.
First of all, my name is Lydia Santi with the last 3-digit name is 086. Ways of improving the effectiveness of travel medicine during COVID-19. COVID-19 pandemic has caused large-scale disturbance of travel industry. The travel industry is a major part of the global economy. The decreased number of tourists coming to Indonesia is happening due to the people's reluctance to travel and worry about the possibility suffer from COVID-19. As we're trying to back to normal, new policies must be applied to balance the pandemic and rebuilding economy. Indonesia has made policy restriction on travel to and from countries that are still in the red zone of COVID-19 transmission.
My name is Gregorius William, and my last 3-digit NIM 085. With COVID-19 outbreaks, travel preparations must be improved, which include 3 major components. I will explain it one by one. For the first one is travel risk stratification that refer to risk for severe disease that associated with age and comorbid. mean when got infected with COVID-19, older individuals have more severity than younger children, and someone with underlying disease possesses more fatality rate than someone who doesn't. Then, threshold for risk emphasizes that the importance of travel must be equal to the risk to be faced. Other than that, individuals with COVID-19 history tend to have better immunity system against COVID-19 than someone who doesn't. The second component is elements of travel. Public transportations and places could be COVID-19 transmitter, so that need to provide enough room to avoid crowds and maintain health protocols. The last component is policies imposed by health insurance, employer, and government regulations at both origin and destination country. Health insurance must assure travelers' health, and the government should develop medical resources. Both origin and destination country must do tests and trace during the passenger arrival and return. Furthermore, restriction could be implemented.
My name is Gusti Agung Dharma with 3 last digit. Name is 087. There are some potential game changers that could allow people to travel more freely and more safe. First, vaccines should be available, affordable, and safe for everyone. Healthcare workers is the key of vaccine decision. They must be able to persuade people that vaccine is important and safe. Second, effective and safe treatment should be available widely, therefore could prevent any disease and death. Supportive care measures like ventilation, oxygenation, and fluid management remain the standard. Third, discover methods that use genetics or other markers which could identify 5 until 15% of individual risk for getting fatal disease. Fourth, available, effective, easy to use, and safe oral drug that could prevent infection. One of oral drugs that is expected to use is ivermectin. Fifth, finding immune, plasma, or monoclonal antibodies that could prevent infection for some specific period. Six, finding a new model of vaccine that is safe for pregnant women. U.S. Center for Disease Control and Prevention (CDC) said that vaccination during pregnancy have high risk to get complications. So, current vaccine is not recommended for pregnant women. Therefore, new model vaccine is needed.
All the scenarios above are need to be done to prevent more spread of the viruses. Awareness of pre-travel advice and intervention should be improved. Various sort of policies and restrictions that happen because of COVID-19 remind us about the importance of travelers' health in global health security. Travel medicine clinician as the backbone for this part of the health industry has the expertise and knowledge to help people with consulting about pre-travel advice during travel and post-travel to minimize the risk.
My name is India Anantaseno with last three digit of name 091. The conclusion of our student projects are travel medicine is a practice of medicine which focuses on pre-travel, during, and post-travel care. Travel medicine is mainly focuses on two things: preventive care and health risk management for global travelers. Preventive care includes pre-travel assessment and consultant, preventive consultant and education, and travel medicine triage algorithm. Health risk management includes immunization or vaccination as an example. The application of travel medicine could be beneficial for Indonesia because it could bring a lot of money, since most of Indonesia's money resource is through tourism sector, and it has been quiet since the start of COVID-19 pandemic. There are some scenarios in improving the effectiveness of travel medicine application during COVID-19 pandemic. Persuading everyone to take the COVID-19 vaccine and an effective and safe treatment for everyone using a method that uses genetics that it could identify 5 to 15% of an individual risk for catching fatal disease, taking oral drugs that can prevent COVID-19 infection, finding immune plasma that could prevent infection for some specific period of time, find a new model of vaccine that is safe for pregnant women.
I am Arya, and the last digit of my name is 075. As an advice, the writer suggests that travel medicine practitioners should develop themselves in providing vaccination that are available, affordable, and safe for everyone. Other than that, the writer suggests that the Indonesian government apply more travel medicine to improve healthcare and reduce the impact of risk assessment for travelers. The writers also hope in the future someone could provide the data statistic for the impact of COVID-19 directly on the tourism sector in Indonesia.
Okay, that's all of our presentation. Thank you for the attention. Om Santi Santi Santi.